A new health facility has been inaugurated at Salem Hospital, Kolonyi by Dr. Alex Wasomoka, Assistant Commissioner Clinical Services, Ministry of Health, who represented Honorable Dr. Ruth Acheng as the guest of honor in front of many guests, including those from the German doctors. Dennis Medei, the Director, Salem Brotherhood, thanked all development partners, Salem Brotherhood International, German doctors, the Ministry of Health, and a government-private partnership, MBALE City Local Government, for funding Kolonyi Brotherhood, Uganda, among others, the late and the living, that have put a stone on the hospital.
I want to thank all our development partners, and I will start with Mr. Samuel Mula, Salem International. Thank you so much for being very close with us here. We have just seen a monument there. Somebody came and lit light in MBALE here, and the light has kept on lighting, and this shouldn't be taken for granted. It is out of your good leadership and your good open heart for the people in need. Together with your team from Salem International, Madam Gertrude Swaizer-Era, who is part of your colleague in working together. Thank you so much, and in a special way, Gertrude, thank you for being with a very big heart. It's like a stone in the ocean, that you have been able consistently to support this organization in addition to other partners who have done it. Germany doctors, you are so great. You are an anchor at the moment for the function that we are doing, and we thank you. Take back our very, very immense regards to the team of Germany doctors in Bonn. You have heard from the people's mouth themselves how they have benefited from the Germany doctors, how they have benefited from the entire community of the federal people of Germany. So everybody who is here, you have been honored. We honor you. We thank you. Our local partners, we have several of them, and I will begin by recognizing the Ministry of Health. Ministry of Health, thank you so much for being good partners under the government-private partnership. All what we are seeing has a lot of your inputs, because without a favorable environment to enable us have what we should be having, where or from the Ministry of Health and other partners shouldn't have been possible. So please take back our thanks to the entire ministry, to the entire government, that we people here at Salem, but also representing the community here, we are very grateful. And we also thank you for having braved the journey to reach here to come and grace this occasion. Thank you so much. We want to thank you so much, the MBALE City, MBALE District Local Government, where we graduated from to get into the city. Thank you so much for loving us, loving this community. Whatever you have done to this place in Salem Brotherhood is not for us as workers of Salem Brotherhood Uganda, but it is for the entire community, the taxpayers of this country. So on behalf of the community of this area here, in this region, we thank you, the local government, and everybody in your various capacities, for honoring and loving your voters, for loving your taxpayers and giving a return to them through the contribution you do via this organization, Salem Brotherhood Uganda. I want to recognize one of our local partners, that is the MBALE Coalition Against Poverty, being represented there by Pastor Apollo Mwenyi. Thank you so much. MBALE Coalition for Against Poverty is a very strong partner with us, but also in the region, because they have done quite a lot in this region. I'm not here to speak on their behalf what they have done, but they are supporting this area with the PHC funding, with the capacity building, and they mention it all. In fact, a lot has been with us in connection. So, MBALE Coalition Against Poverty, thank you so much, and our regards to your partners and your other partners. the health facilities near us here who are surrounding us. You are the people who are encouraging us. You are the people who make these structures exist and our services be here. So thank you so much. I've seen the team from Bukedi. I've seen the team from all the surrounding areas. You are very great people. Otiba and Joseph Ochereme were the first people, the first two government employees who accepted to leave their government health facilities within Soroti Regional Referral Hospital, and she came at the same time to work in this place. So we recognize you so much. We thank you so much for your good hearts to come and build. All what we see here and we are celebrating is anchored on your very good hearts and your inputs and endurance. Thank you for joining up the planning, collaborations, and shared vision to have or to make accessible, compassionate, and quality health care within this region. What we are seeing here has been collaborated efforts like I've mentioned earlier. I want also to thank one of our once partners. Once a partner is a partner from Liberalization Africa, and that was Professor Peter Smith. He came in here to work with us in the school development, and indeed he gave us the first draft that he sent it to us, that we should be able to understand it and redesign the way it should be. This gave us a foundation of escalating into what you can see and what we have just inspected here. So we thank him, though he's not with us. Professor Meapo, please convey our thanks. We appreciate that you have helped us so much. Those stuff we have said. You have already heard here, we are integrated. We have taken a lot of health care services to the people in this region. We are working in Bukedi district, and we are working together with various government health facilities as partners. We do capacity building there. We supply or we give also equipment, best equipment, some of these facilities can use in the program of improving the health care, especially of the children and the mothers, as our focus, like you have heard from the chair of the board of the hospital.
The director also added that all leaders should take a lead in taking this facility to another level, because it's an external funding which should benefit all people, not a few.
So please, all of you, as we are here, we are not hardliners. In case of anything, we listen, tell us, express how you want your services to be delivered to you. We shall do that within no minute. Don't keep quiet, don't go away grumbling, don't cause problems. This is your facility. We all join our hands together to make sure that we benefit out of this funding. This external funding. It's not for us, it's for all of us. And as leaders, please take a lead in ensuring that you knock on us where we are not be able to do or to read. Today, we celebrate not just the opening of the buildings, but the beginning of a new era of health care in the region. Our dear chief guest, we stand before you here today as Salem, an NGO and not-for-profit, in three folds. One, we thank you for accepting and honoring our invitation. And then two, that you are good ministry, that you represent strengthening the togetherness with the Salem Kolonyi Hospital through the government-private partnership policy to give value, accept, and receive this funded project. You have received, or you are going to receive this project on behalf of the Ugandan. So join us to make a good use of it as a ministry. We are saying also that support our primary care system by improving on the PHC funding. We are serving financially weak and unstable population. Mr. Guest of Honor, if this one is done, we are within is a reach, and soon we shall be able to declare if our operational costs are made so reduced by your very good support that the guests and everything, people walk in and get the services and walk out, as we proceed to continue lobbying for this country from our donors. But the honor also is with the ministry to see to it that you put in the effort to reduce on the cost of the people who can benefit from this facility. And this is when our funding opportunities, our drug inputs, and our capacity staff is put in place. Then we may not need to demand a lot of money from the communities of these people for operational expenses. Thank you so much. I want to thank once again everybody. I thank our dear guest of honor. I thank the German Embassy for the good representation and the high scale of linkage. We are really very appreciative. We thank the German community, and I thank all our funders and all our partners once again who have contributed to this milestone. It's not only this building, but the beginning was under fig tree, and this is where we are. So from a big tree to this, it means there have been so many drivers to this achievement.
Joseph Balisanyuka, who is the chairman board of directors, Salem, Uganda, said they have overrepeated themselves on the issue of elevating the facility to a hospital because amongst the many advantages, one of the biggest advantage will be to decongest the referral hospital of MBALE.
Guest of honor, you have heard everybody who's talking here is making a request. We don't want to over-repeat ourselves, but I think having toward the area, what we have seen, I know you are going to make a comment, but I'm sure it's going to be a good one. We are requesting that in the spirit of partnership with the Ministry of Health, with the government of Uganda, that we elevate this facility to a hospital. The advantages are going to be many, but one of the biggest advantages will be to decongest the regional hospital in MBALE. Because some of the services will be offered here, and others will be offered in MBALE. So we as a board, this is our major request. We have been partnering with the Ministry of Health in many areas, and you have no doubt that this request will be considered guest of honor. In the interest of time, we don't have much to say, except one thing. As we introduced ourselves here, we want to pay tribute to the late Dr. Tunde, like already mentioned. He was part of us, but God is God. He's not with us. But he has been the brain child behind this facility. And we want his soul to rest in peace. Once again, I thank you all for coming. I thank all our visitors, especially those who have traveled from overseas, for coming here to witness this big occasion. We wish you a good journey back, and the Lord will lead you to Zurich well. We shall continue as a board to make sure that we push Salem, Uganda forward. They have been told there are many things here the director has gone through. We have a schools of nursing, we have many, and we want the community. And by the way, before this occasion, we've been running here a medical camp for a week, and you have seen the number of people who came to consume our services. That is already a testimony that they have trust in what we do.
Dr. Alex Wasomoka, Assistant Commissioner Clinical Services, Ministry of Health, who represented Honorable Dr. Ruth Acheng as the guest of honor, thanked Salem Hospital and its partners for such a magnificent building with a functional theatre and a maternal child health facility. He appealed to the stakeholders for a sustainable plan for the new facility because it needs to be maintained to uplift it as they wait for the government to elevate it to a hospital.
For us as Minister of Health or as government of Uganda, we are so grateful for all that work, all the effort each and everybody put in to ensure that we get this magnificent building in place, and not only a building but also a functional theatre and maternal child health facilities in this hospital. Thus, we are always there to support you, and you get where you want to be. Besides, it is our duty to ensure that services reach each and everybody in this country. As guided by WHO, that we should leave nobody behind. And once you get a hospital status, I'm sure more services will be available in this area. So once such services are available, we will expect that you will serve a bigger population, and that will be to our side as government. So far, so good. Because one of actually the RCC was saying that, mentioned it earlier, that these services we are supposed to be offering them, and as the government we offer them free of charge. So when we see these partners like Salem Brotherhood and the other good-hearted people coming along to work with us, actually that to us we say it is a plus, and we have to support them to work better and improve the services such that each and everybody will sit back there and appreciate what the government is doing. I want to also to task the people around here, all the stakeholders in this, because we have, much as the Salem Brotherhood have worked towards achieving this, but we must have a strong, sustainable plan. Sustainability. Today it is a very magnificent building. 10 years after now, it will not look like that. And we shall need to maintain it or even make it better, uplift the face of the hospital. And that one needs concerted effort.
He also said that the government will continue to support Kolonyi Hospital because it does a lot of work in the decongestion of MBALE Referral Hospital.
The main purpose of us looking at this hospital, or this health facility rather, as so important to us as a ministry, or as ministry, we would like to decongest the regional referral hospital. There are those small or other cases that can be sorted out to this level. So if this facility is working very well, then the regional referral will receive only the very complicated cases that deserve to be there. Because we have very senior doctors there, experts, who can offer specialized services. But those which can be offered by the general practitioners should end here. Otherwise, we are receiving very big number of simple cases, malaria, cough, in the regional referral, congesting the hospital and actually overstretching the resources that are provided for there.
Lydia Akiding, Bukedi Times, Kolonyi, MBALE City.